Good afternoon, good evening, good morning, ladies and gentlemen. Beloved President Dr. Ismail said, and respected participants from different parts of the world. Today, IFPH is going to have its 322nd uninterrupted Zoom webinars. And this day is very important because we have got a very distinguished personality as our guest of honor. He is not an unknown face for the participants of IFPH webinars because he's a regular participant in almost all the Zoom webinars for the last one and a half year, 1 year. And it's my pleasure to introduce and welcome Dr. T. N. SREEDHARA KURUP, who is also a close friend of mine, and he is known to me for the last 47 years. He was 3 years senior to me. We were the alumni of the same institution, Adhirashramam NSS Homeopathy Medical College. Is also to be introduced as the brother of my close friend, Dr. T. N. Parameshwara Kurup. Dr. T. N. Parameshwara Kurup also is a known figure for the participants of this Zoom webinars. Dr. T. N. SREEDHARA KURUP got his diploma from the Adhirashram Homeopathy Medical College in the year 1975. Thereafter, he had his graded BHMS course from Jaipur, and followed by that, he had his Master of Medicine, Doctorate of Medicine from the Aurangabad Homeopathy Medical College in the year 2005. He was the lecturer in two colleges during the period 1978 to 1982 in two states of Punjab and Gujarat. But he is known not as a lecturer, but he is known as a man who served Central Council of Research in Homeopathy for a pretty long period of time. He was in the institute, CCRH, since 1982 and he retired in the year 2000. He occupied various offices in the Central Council of Research in Homeopathy. He is an enthusiastic, a very diligent, knowledgeable person, and he had his MSc in psychology in the year 2011. Before that, he had his MSc in yoga in the year 2008. He is the winner of the prestigious Dr. N.K. Jaram Award in the year 2012. With these few words, I introduce Dr. T. N. SREEDHARA Kurup and welcome him to take over this august platform. Dr. Kurup, you are welcome.
Thank you.
I forgot to mention the topic of his presentation is on depression and how homeopathy can prevent it, manage it, and how the suicides are also prevented by homeopathy. So, Dr. Kurup, please.
Yes. Screen sharing. So, first of all, I can start the screen sharing itself. Then I can talk also. There is no problem. Most of the people may know me.
Yes.
So there is no need of showing
Okay.
my face. Of course, they can see me. Okay, now I can start my presentation. First of all, I thank the authorities that the IFPH, International Forum for Homeopathy Lovers and Doctors, their relatives, the interested people, students, and all other doctors, especially President, Secretary, and all other committees, Joint Secretary, Dr. Kodiad and Dr. C.J. Varghese, and Dr. Latif Sar, and like that are so many people I like to say, but simply I like to say one word: thank you from my heart. Thank you very much. And I thank Dr. C.J. Varghese for a good introduction. Of course, I was serving up to 2012. I retired on 2012. Sorry, it may be some no problem. But anyway, today's topic, that is the role of homeopathy, depression and prevention, is a very relevant subject, because last 1.5 years all over the world, people are suffering from different ways. The main is, first of all, when they may hear about even that our whole world, it was shut down, and people are day by day, they were dying. By hearing that, we will feel it is, once you may suffer, then you will be more fearful, because I also once suffered for about 1 month back. So I know the difficulties. That it is just like that of, you are, most of the people may be keeping just like that of in a jail. So that itself will cause so many problems. That I shall come to that. Before that, the pandemic, that when we hear about its symptoms and people are dying, first that it was senior citizens. Nowadays, even the young people, even children started dying. When we may hear it is our near and dear may die, of course, everyone will feel. Really, we will feel. Someone's father, someone's mother, someone's sister, someone's wife, husband, children, all they are dying. Simply we are looking and we cannot do anything. First of all, that they got a fear, then anxiety, then that they are suffered different types of the problems. Financially, the people people that how they fear, and not only that, their income started coming down and down. Last 1 year, some people cannot open their shops. Some people cannot go to their work. Some children, they cannot go out and play. Think about our young age. We are enjoyed lot of companies, friends, playing easily. The last 100 years, that means 1 century before, there are so many other diseases came. The last 1 century, this is the biggest thing that cannot be prevented with that the vaccination or any other measures. You cannot, without homeopathy, you cannot prevent this pandemic. Definitely, I can say homeopathy is going to be one of the systems it can help. That would be the alternative for this new generation, and all over the world it will be accepted within, not only maybe a little more time it will take, but definitely it will take. Anyway, I am coming to the point that the world economy is completely down, that everyone knows, but still we must have to exist, we must have to overcome. There is no other way. So the one of the main problem is people are suffering from depression, because so many reasons. That I can say the one of the most important thing, that that depression. Some of the cases I like to share with you the few cases first. Otherwise, I may not be able to, people may not understand. Really, in 21/6, last month, I got a case from Calicut. From 2 months before, he was suffering from corona, and after that he got depression, sleeplessness, gas formation, dreams of different types, no appetite, cannot take any decision, difficult to concentrate, severe weakness, irritable and angry. First, I was prescribed Ignatia 0/3, SOS, Natromore 6X, Passiflora mother tincture, Avena alpha malt, but he was better. He again called me in 1721, better, getting sleep, appetite improved, gas formation, advised to continue the same medicine. 10/7, he came, called me again and getting sound sleep, appetite improved, no gas formation, weakness improved, depression also improved, not getting angry. 18/7/21, more than 75% of relief, continuing the treatment, but still he feels some sort of depression, still he is having occasionally. That is the number one case. Second one, a male 70 years from Bombay was suffering from COVID. He got fear, started trembling of his body, increased his BP 210/100, blood sugar fasting came to 198, BP 460. He was having dullness, drowsiness, vertigo, fear, etc., sleeplessness, no appetite, fear that someone is coming for him and to kill him. He feels that he may be killed in the hospital itself. He feels that he is going to die. He was given some medicines from to the hospital, but he forcibly discharged, and I assured him, he called me, then I assured him that I am along with you till your discharge and till recovery. I will be, assured him. Then after that, I prescribed Gelsemium, Mannam, 1 dose, Natromore 6X, TDS, then 1720, better, trembling disappeared, body weight reduced. Now only little trouble is there, weakness, body pain, some irritability and itching all over the body, especially ear, nose, head, and in the scalp. Disturbed sleep, dreams of dead people, prescribed manganum acetate because of diabetes also was so high. Natromore and Avena Sadeva was continued. BP came down to 160/70, blood sugar 110 fasting, PP postprandial 142. 87, everything was improved. Natromore given, Avena Sadeva malt was given, Ignatia 0/3 was given, and he was somewhat recovered completely. And like that of so many cases, I'm going to, if there is a time, I shall go into detail later. So now I shall show to my slide, and that my screen sharing, I am going to share screen sharing. So I like to interact more, so I may take 30 minutes or 40 minutes maximum. After that, I like to interact with the people, what they feel and what they are suffering. Such things I like to do. What is depression? That depression always the life one way or the other way. What people are suffered, but people may not report. When their circumstances changes, that it may improve automatically, but they may not understand. If someone is telling, I am not felt any time in my life depression, he is a number one liar. Because everyone is one way or the other way, one day or the other day, definitely they are suffered the depression. The mood will change. Then sometimes sleeplessness, appetite, and everything will change. But when it is not a problem, so the people may not take it into consider, because if they may not go to very deep depression, unless and until it may not be a problem for the family. Usually they may sit in a corner and they don't make any problem. But sometimes when it is very deep depression, they may go to suicide, or suicidal tendency can come. That time only they will bring the patient to the hospital or to a doctor. But usually they may go to a psychologist or a psychiatrist. But our homeopathic medicine is far better than any other medicine in this world. That when you may take definitely 100% cure you can give. Other mental diseases, you cannot give that much cure. And another thing, you must have to change the place and circumstances also. Sometimes it may not possible, because some nearest and dearest people may lose their life, and sometimes they may lose their business. Such circumstances, sometimes it's approach, the mentality of the patient can change up to certain direction. For that purpose, it required counseling and meditation, some other therapies also required along with homeopathic medicine. Don't think that everything will be cure 1 or 2 doses of homeopathic medicine alone. There are so many other treatment means, not giving simply the medicine. It is so many other factors. So I like to go for the depression. What are the signs and symptoms? Number one, sadness. Most of the people may be sad one or the other day. Always you cannot be happy. But sadness without cause also it can come. Some people are moody and they may not talk too much. Their sleep may be disturbed. They have no interest in working. Their routine may be interrupted. So sadness is one of the number one symptom. And signs and symptoms, number one is the sadness. Second one, no interest. Some people are very energetic. In our this forum itself, we know some people are very energetic. Every time they are asking something, they like to learn, even in old age also. So some people, if you may tell, oh, I am old, this much is sufficient. I have not that much interest. Because why I am telling, recently I went for TA learning in one institute, and I learned and I became to a coordinator. So they gave me an opportunity to take 255 people for that group free. Then I sent whatever the people who knows me, I sent that link. But then I asked, they told, oh, it is old age. Now what else we can do it? I am retired. I have house. There are the children are studying. But there are some people, they are retired, but still they are working. Very compare with that earlier, when they are young, more than that they are working. We know so many people in this forum also, they are enthusiastic and they like to learn more. They are every day from 8:30 to they are sitting up to 11:30, or even they are ready to, if the talk is very good, class is very good, they may go up to the 12 o'clock without interruption. Then another thing, guilt. Guilt means sometimes what happens, when knowingly or unknowingly, sometimes we may do some mistake. Then we feel guilt. We must not do this way or that way. That can cause. It is useless to live in this world. I am done a very big mistake. That myself only know that. Sometimes even others may not know that, but they will feel themselves bad, and they will feel I am not a person to eligible for to this world. Sometimes they may feel such type of guilt when they may do some mistake, or they may get some bad experience with some people also can get such type of guilt. Then next one, physical weakness. We know some people are for accidents. Some people may get some chronic diseases and they like to lie, especially cancer and such type, sometimes even diabetic also. When they are not able to do anything and up to the mark, when they may see the other people are doing, I cannot do, I cannot walk, I am still lying bed, since that it is most of the time the elderly people, when they are aged, they will feel that others are not caring. This even mentally also, not only physical, mentally also, they feel weak. Their income is reduced. What they were once in upon a time, they were very uh, great people. Nowadays, even their children, wife, and near and dear, even friends are not minding them. They will feel depression. They will feel bad. That physical weakness, not only physical, even mental and emotional level, some weaknesses can cause depression. The poor concentration. The people, I have one patient, since last 3 years he is taking, he cannot concentrate in the things. When his boss is telling something, but he cannot concentrate. But the he cannot remember the things properly. When he may attend the meetings, he can understand. But when he may reach to the home, he will forget everything. But anyway, now he is improved so much with the homeopathic medicine and giving that the not only medicine, giving that counseling also, it is helping for him. Then another symptom is that no appetite. The once you are having good mood, you can eat, you can enjoy the good food. But once you are suffering, when you start suffering some of the things you cannot enjoy, then you may not able to get good appetite. You will refuse the food. That sometimes when you are anxious to go somewhere, if you may not have a proper food, a proper ticket, you cannot take the food. Why you cannot take the food? Even if you are having that small injury in your hand or some sufferings, you cannot sleep. Why you cannot sleep? Because the whole body is yours. The holistic approach is that some of the small problems, physical, mental, or even small problems also, you cannot get appetite, you cannot sleep. All these things can happen in depression also. Then loss of weight. When you may not eat properly and you are having this problem, loss of sleep, and sometimes more sleep can happen. That time weight will reduce slowly. Some people will eat more. There are some rare occasions they may increase their weight also. Then sleeplessness, that I already, whenever there is a problem, definitely the first that sleep will be disturbed. Of course, after this COVID, there are so many after effect of that COVID. There are so many people are first they are complaining 1 or 2 months there is sleeplessness. It is even they are getting sleep, it will be disturbed sleep. Then suicidal thought. That it is the most difficult part of the symptoms. that the suicidal thought. Once you will feel you are not eligible for this world, you don't love yourself, you don't love this world. That time somebody is not having to love, and for love, you must get love and you must start to give love. Then only you can exist. He will feel no one is not loving me, anyone is not supporting me, even the family members, even I don't have a good friend, they are not supporting. If someone may come, at least one person may come, that time definitely that fellow can be saved from to the suicide. Sometimes it may fail the suicidal, they may fail sometimes due to so many reasons. But one may fail, still they may try. But we are having very good remedies like that orum and natrosol. Once you may give this medicine, never they cannot. In their whole life, they cannot do the suicide. Their mind, their emotions, everything can be changed. They may change their decisions. I am treating last 5-6 years so many cases from, there is a place called in Trivandrum, there is one association, they are called the Sanjeevani. They are, I am also one of the panelists of consulting them, consulting the patients. They are coming for depression and suicidal tendency. I am giving medicines. Mainly I am giving, when once they may side, according to homeopathy, according to the symptoms only we can give. But this Moramet, Natron salt, Natramur, Ignatia are wonderful medicines for our Metia Medica. Really, I feel, of course, we cannot become, any person cannot become God, but I feel, I respect, I will pray sometimes, even the Hanuman. He was a great person, what he was telling for the suffering humanity. The God shown me this homeopathy for the suffering humanity. It is really correct. Day by day, I feel that his respect, not big word, but very near to the God. I feel he is one of the wonderful man. So he was, due to him, we all are able to cure so many so-called incurable cases, definitely. So homeopathy is great, Hanuman is great, so homeopathy is great. So who believes in that, definitely they are also great people itself. Okay, then next we can go. What are the causes of depression? Causes: biological, physiological, hereditary, congenital. What is biological? There are some causes, some problems in our body. Example that some hormonal imbalance or some type of the diseases, it can cause biological changes. That is called biological. Then physiological. Physiological means the physical problem. When I said about the biological, I forgot about telling the dopamine, serotonin, oxytocin, etc. Some neurotransmitters are there that will have some changes in our body. It will control. It will, you will get easily when you may play with the children, when you may jumping and running and playing, you will get very easily these neurotransmitters. They are having a good role, big role to play into the uh, depression, causes of the depression. Then physiological, that also, that some physical problems that can cause also the depression. Then hereditary. In some families, most of the people are suffering some mental, especially depression is also having some hereditary factors. Then congenital. Congenital means when you are born, some people are very dull. Maybe some problems during delivery or sometimes during pregnancy, maybe the difficulties that that is the cause of that is called congenital. Without cause also some without some causes also, you may get that the depression. That can also without cause also. Idiopathic, that the others are telling, idiopathic, that also one of the cause. Now, what are the medicines for depressions? There are more than about 50 medicines are mentioned in different grades, but I am mentioning only depression main medicines. 3-grade medicines are Aurum, Carboanimenes, Graphitis, Ignatia, Netromo, nitric acid, Sorinum, etc. According to homeopathy, we can select with other accompanying symptoms also. Allied symptoms also we can consider, and only we can take physical, mental, emotional symptoms we must have to select according to. Then any causeless, Netromore, Phosphorus, and Staphysaccharida will give a very good result without any cause also. You give blindly Netromore. Blindly, if there is if other medicines are failed, then you can give this medicine. Definitely you will get some result. Then the children in arsenic, calcarea, and placosis. That are the 3 medicines. Then poison aggravation, not hard, poison aggravation, Netromore, sepia, sulfur, and poison, it causes depression. Some people the next day after that their sexual contact, they may be depressed, whether male or female. It can come in both. Company society aggravation, Euphrasia, humiliation, bovista, domestic affairs over sepia, eating aggravation, graphitis naxomica, amelioration, tarantula, emission from naxomica pulsatula, enjoyment, ignatia natromor, fear from sickly core, proverb smell from Iosiamus, girls before puberty, arsenic, Heliboros placosis, grief from, it is a spelling mistake, grief from Nux mosquita, happy on seeing others, Cicuta, Heliboros, health over one's sepia, indifference alternating with, that is also sepia, love unhappy from digitalis, masturbation aggravation, quinine, Netromore, phosphoric acid, platina, menses before, Netromore, pulsatilla stanum, suppressed, quinine mag, music aggravation, digitalis, natron salt, Sabina, natron post, distant music, rising, sad amelioration, manganum. Pain from, here I is not there, pain from, it is today only, it is very, only one day I got the, yesterday only it is confirmed, so immediately typed it, there are some spelling mistakes, sorry. Sarsapatla, parturition after, peridion, perspiration during, quinine, pregnancy in lacosis. One part I cannot, it is not moving.
You can close that side window, doctor.
The side window.
You can
It is going back.
go to the view and put it in a side-by-side speaker. Then you will be able to see you.
Anyway, I shall talk without seeing. Only very few are there. That I shall talk. What about up to the which? What about the pregnancy? Only very few are there. Then puberty at Antiocrodon, Heliboros, natron, girls before puberty, arsenic, Periborus bacchus, sad stories from Cicuta, sexual loss of power from Spongia, sterility from Aurum, sunshine aggravation, stramonium, sympathy aggravation, Ponayam, thunderstorm amelioration, sepia, waking on, aluminium, coccus cacti, bacchus, walking only while phosphoric acid, beep cannot, ammonium, gelsemium, natron, beeping amelioration, digitalis, medornum, phosphorus. Okay, then can go to the next. See, this I am not going to explain too much because the homeopathic, these things that you know, similar single remedy, minimum dose, potentization of course, tuck proving individualization, miasm, soras, psychosis that I am not going to explain because most of the people are knowing. If they may not know, they may ask, I shall explain. Then this mind, this circle that you know, the inner circle is the mind, the outer circle is the physical body, and in between the emotion. In any of this plane, anything may happen. It is just like that of water and milk. It will, all these places, even physical change, mind also, emotion will affect. If the mind, something will happen, it will affect emotion and physical. Like that, some emotional problem, it will affect everything. What this can cause, this effect can cause that the depression. That is why I was mentioned this one. Then, and when the depression is more, there is a suicidal tendency. There are so many medicines for suicide that I am not going to explain because now it is already about 35-40 minutes are over. So I like to always to talk with the people, and an interaction is most important in every seminar, what I feel, Zoom meeting. So I am going to mention only what are the medicines for suicide: blood seeing on 1 medicine, broadening 1, by drowning 6 medicine, by hanging 3, by poison 3, by shooting 3, by starving 1, cards under 3, mania. Because let the people may know there are good medicines for all these things. That is why I am going to mention. Height leaping from 5, homesickness 1, knife seeing on 1, love disappointment from 3, during menses 1, music from 1, pain from 2, weeping amelioration 2, other allied therapies. See, sometimes some of the problems only with homeopathic medicine, most of the cases without homeopathic medicine, you cannot cure any depression, very difficult. But some counseling techniques are there. Some psychotherapies also will be help for this counseling. Counseling is one of the main tool for the depression. It is very effective. What I feel, I will do the counseling along with the homeopathic medicine. Second, meditation. Let the people may take some meditation every day. It will give you very good strength and your energy, and you will feel more happy. Even you know the Gautama Buddhas and all olden days, that the sannyasis and everyone who became to the more famous people, even God and goddesses were also doing meditation. That is why they got special power. 3, faith in God, that is essential, because you feel there is something above you, there is something that it will help you. When you may tell every day, pray, you are feeling that your God will safeguard you. That feeling will make you positive thinking in your body. When you may think about positive, there is potassium will generate in your body automatically. That mechanism is in your body, is there. When you may think about negative, that you will feel there is a sodium will produce. Sodium is a destructive, potassium is a constructive. So whenever you may say, even into the end, that the last part of the life, when you are going to, very well this case example for the stage of cancer, then you can tell at least one person, not tell other. Always to encouragement is the one of the best way in the life for treating and even patients, and for a person to get improvement in this life, that you can give love, faith, and that your positive thinking, that it will have a very good effect, that definitely it can help you. Even meditation will help, even depression also. Fourth one is yoga. Like that of the mental health, yoga, totally yoga, Ashtanga yoga is there. 8 limbs are there that I'm not going to go to detail. That pranayama is there, that this exercise, that yoga asanas are there. Then you must have to make your body very pure, and so many other things also there. Even pranayama is also there. Last only that you are salvation. Before that, sannyasa and such, so many things are mentioned. That yoga is another subject. It is a vast substance, so I am not going to very detail. Pranayama, that you can give even to the patients who are in bed also. They can do some pranayamas. It is not a big exercise. It is controlling to the breath. Without taking food, you can live even up to 1 week. Without taking water, you can live even 1 day. Or some people that Hasare and etc., they can live little more days. But without breathing, you cannot live. Oxygen, when pranayama, when doing, you will get more oxygen. Purified oxygen you will get, and the carbon dioxide will be exempt. There are some technique in pranayama that I am not going to explain very detailed. It will take little more time. So I am not going to, because now itself is about to 40 minutes. So I like to close and go for and to finish in the exact time. The other treatments, example, psychotherapy and physiotherapy, occupational therapy, and what Hanuman was mentioning, mesmerism, but it is that this Hanuman, so your mind, subconscious mind, you can change. It will always to be negative thinking will absorb easily, but positive thinking will be very difficult to live. So psychotherapy and even counseling and this hypnotherapy will be have a very good effect. And like that of there are water therapy also. Hanuman mentioned electricity, magnetism also will help all these things. That is why I made etc. What about the time? Anyway, thank you very much. Now that it is a time for discussion, you can go. Thank you very much, the organizers and the listening, the people. I thank you especially from my heart. Thank you one and all. Most welcome for the question sessions.
Thank you, Dr. SREEDHARA KURUP. It was a very wonderful session, very informational, and I am sure that participants have very much become benefited out of your presentation. And now the floor is open for discussion, and 4 people have raised their hands. I request all of you kindly be crisp and short while you raise your questions. And now 5 people have come with raised hands. First, I go to Dr. Matthias Vengai.
Uh,
Is
Good evening. I am an engineer
Thank
by
you.
profession. I am not a doctor. I am having an organization, connected with an organization named Sanjeevani, which is a suicide prevention center, which is working under the umbrella of Befrienders International. Its phone number is 9400033900. I'll repeat once again, 9400033900. Mr. Sreedhara Kurup, Dr. Sreedhara Kurup is one of our panelists in the among the doctors. We are having a panel of doctors from homeopathy and also from general medicine. I mean, modern medicine, homeopathy, Ayurveda, and all. Dr. Sreedhara Kurup is one of our panelists. We used to refer to many doctors, and we found that Dr. Kurup was excellent in dealing the suicide prevention or depression cases. One of the case, I may say that one girl, she was married, having a son, and her husband was abroad, and she actually wanted to commit suicide. She was at the verge of suicide, and we referred the matter to. Actually, we cannot refer. We will ask the patient, or not the client, to contact any of the doctors listed. Then they will ask who is better. That we'll say that you decide. Usually, we if they ask a priority, we will give the name of Dr. Kurup, and he was dealing that case, and we found that it was wonderful, and that was very successful, that case. Another case was with an assistant professor who was who is also having some other problems. That is sexual. I don't know the exact technical term in the medical side. Some sexual perversion. For that also, Dr. Kurup did excellent intervention, and there are more cases, many cases, not more than a dozen, some 40-50 cases he attended, and we found that most 99% cases was successful. It was reported. Some people may not report, so we cannot say anything about that. Most of the cases reported was successful. Thank you, Dr. Kurup, for giving an enlightened session on especially you mentioned about counseling, meditation, yoga, faith on supernatural power, and you also mentioned about the physical, mental, and emotional level of the patient. As I am not a doctor, I cannot comment on that. Anyway, it is a good session. Thank you so much. Thank you so much.
Thank you, Mr. Matthias, for your comments. And next chance goes to Dr. Hubert. Please unmute yourself, please. You are mute. Okay.
Hello, sir. Can you hear me?
Yes.
yes.
You are a man of great wisdom, sir. I want to a good-hearted man. From our perceptions, always we can see you. But I want to say, I want to ask you, sir. I think that you are regularly reading Bhagavad Gita and all. I think there is Bhagavan Sri Krishna says 3 types of categories of people. They are Sattva, Rajo, Tamo, Guna. In such cases, in such persons, if Tamo Guna is more, that means that they are always greedy and making money, and that type of materialistic thing, they will do anything. Such cases, how can you manage?
That is why that they must have to change their food habits, and even they must have to. I told you, that is why I told them you that regarding to the yoga and pranayama and etc. I told you, even counseling. And that with that, their diet will be changed. They will be given counseling. And through that counseling, you can change their ideas, and even the food, that tamoguna food is there, and even rajasa guna is also there. It is mentioned in Gita, Bhagavad Gita, it is mentioned, and we must have to teach them. And rajasa guna food is also there, that they must to avoid such food, and they must have to give counseling. And with that counseling, you must have to ascertain that these bad habits, that values of life must be correctly followed. You must have fear with the God, and you must have to fear with the society. You must live a very healthy and valuable life. Values of life, they must have to kindness. You must have to teach them kindness, love, affection, and so many things are there that we must have to tell them, and we give a very good confidence to them, and definitely they will change their habits. And definitely our medicines also can change such bad habit. You are a homeopathy doctor, you know very, very well. I'm not going to mention such medicines. Even that is behavioral disorders. Some children, they may call bad names to their father, even parents also. They will come against you also. Such people's habit, by counseling, by giving our medicine, the mood of the person, that the emotional level also you can change. Example, I gave once that while I was in Udupi, one lady came 110 kg. Very, she came for to reduce her weight. But when while case taking, I came to know her son was my one of the intimate friend. Then he told, doctor, you please kindly tell him that he must not go out in the night. He is coming very late, and he is not listening what I am telling. After treatment, her about 20 kilos after 6 months reduced. One day I asked, what about your son nowadays? Oh, nowadays the all children are like that, or no children are like that. Entirety of the patient can change with homeopathy. Physical, mental, and even emotional level, it can change. We are having wonderful remedies in our, but you must take very good case taking, and definitely it can change. Okay.
Okay, thank you,
Thank
Dr.
you, sir.
Guru. Now, two raised hands are there. Time is very limited. Kindly be short. Dr. Bhadranji, your
Thank
turn.
you. Thank you, Dr. Sridhara Kurup's, for giving me a chance to comment in Dr. T.N. Sridhara Kurup's session on dealing with depression and how to control, how to avoid suicide by use of homeopathic medicines. Dr. Sridhara Kurup, you all know, was working in our Mental Research Institute at IFPH, Kottayam. He has very much experience in dealing with depression and related mental ailments more confidently than we. And he mentioned that miasmatic consideration should be done in prescribing with mental cases. We all know the miasmatic approach will help to cure mental ailment, especially depression-related mental ailments. Preventing suicide is a very noble thing. Life is precious, and we all should help to provide to live everybody. His class in this regard was very interesting and very informative. So also we should consider all the cases that approached us to deal with mental and emotional line also. Some 3 years back, a lady came to me with loss of weight, extreme loss of weight, and was asking me medicines for improving her weight. On inquiry, deeply, I understood that he had a son aged 1.5 years. He would not let her sleep. She was working with her husband at military quarters at Jammu. She had to do daily household works at that time and cannot sleep at night. This child
Dr.
was
Bhadran, kindly be short because 2 raised hands remain to be answered and our time is only 3 minutes only. Please,
okay.
let us
Our,
skip
our,
that. Please.
1 minute.
Okay, okay, sir.
However, I didn't give medicine to her and asked to bring her son. And he waited outside and saw the mischievous actions of the child and gave him sworn that cured that child. And she was happy. She was cured. Thank you, Dr. Ramesh Prabhu.
Thank you, Dr. Bhadran. We have to terminate this session by all means at 9:30 sharp. So I request Dr. Lokmani Gupta, your chance.
Thank you, sir. A very good session. So directly I'm coming to my point. As Dr. told about the various situations, the number of cases, mostly the cases for suicide, either they hangs or they jumps in water. And Dr. Saab gave only the number of medicine. Kindly declare the medicines so that immediately we can help to a person having an impulse to hang on or to jump in water. Secondly, sir, there are the conditions of suicide. When suicide increases either towards full moon or towards no moon, Poonam or Mawas. So please give the medicines in all the 4 conditions.
Dr. Gupta, it's due to the shortage of time. You can personally contact Dr. Kurup and he will be getting the answers.
Sir, please.
Thank you,
your
Dr.
phone
Lokmani.
number.
Now, the last person who has raised a hand is Dr. Anand Jaiswal. Please be short, Doctor.
Good evening to all. Thank you, sir, for a wonderful speech. I have asked about a case. A patient come to me. He's suffering from depression since 5 years. Now, 2.5 years, they got a sleepless insomnia case. But he told me, please treat me on insomnia case. Don't treat my depression because I continue allopathic treatment. I can't stop the medicine of allopathic medicine. In such situation, what should I do, sir?
What you tell me once more?
This question is the patient is already under allopathic the medicines for depression. Therefore, don't touch the depression part. You treat my insomnia. One patient asked him how to treat that case.
You must have no need of telling you anyway other things that you are giving, that you include that medicine also in that particular patient without telling. You are treating depression, it will change definitely without knowing.
Dr. Kurup is right. Hope Dr. Anand got the answer. It is
Sir, best flower remedies.
It is our discretion whether to treat. We are not treating insomnia. We are not treating the depression. We are treating the patient, and therefore it's immaterial for us, or it need not be brought to the attention of the patient. You can treat as according to the principles of homeopathy. Thank you all, and on behalf of all the participants who have raised questions, who have very actively participated,
1 minute.
Yes, yes.
1 minute. Whether you are going to stop or
Yes, we are stopping.
Oh, okay. That Lokmani Gupta asked me what is the medicine for hanging. It is arsenic and belladonna for hanging.
Thank you.
it is a very good result you will get. And another question that somebody was asking, that the somebody is violent and that calling bad words and be angry with such medicine. Medorinum is number one. Another is sorinum. Third one is the syphilinum. These can change the mind of the bad thought and bad thinking, that it can change. That are the nosodes, which can also, that it is having, that these our miasmatic remedies also will help. And more than that, our sora is the fundamental cause of all diseases. So sulfur is number one of the very useful medicine in such cases. When there is no relief, you can give sulfur. That it will give a tremendous relief for the profession that I am telling all these things. Thank you very much.
Once again,